Hello, everyone, and welcome to today's episode of the Beauty Justice Podcast. I have with me today Kristen Hanenian, who is the owner of Elite Medical here in Tampa, Florida. She has been in the aesthetics industry for a long time and has recently been focusing much of her practice on age management and treating the internal body versus just treating the outward signs of aging. Kristen is a friend of mine, and she has been taking care of my face and my skin for many years now. So I am just so excited to have her on the show today. So welcome, Kristen. How are you?
Good. Thank you for having me. I'm so happy to be getting to sit here and talk with you.
Yeah, I'm so excited. I know we've been talking about this forever. I kept at all my appointments saying, I'm starting a podcast, and it just took me a while to get it up and running. So happy that we're finally doing this and we get to sit down and chat today. I have a couple of things that I wanted to talk to you about. And the number one thing is peptides. Peptides are something that, I think are really kind of trendy right now. We keep hearing about them everywhere. You're seeing them being advertised in a lot of different med spas, different aesthetic providers. But I think that nobody knows what the heck they are. Like everyone is just kind of, what are peptides? What is this thing? So can you just kind of start off by giving us a little bit of information about the basics of peptides? What are they? What can they do for us? And then we'll kind of go from there.
Well, I would be happy to, but first and foremost, they're not new. I mean, I think that's the biggest issue. I think they're just gaining this, much like we hear that term biohacking, everywhere. They're just really gaining traction because they're being talked about more. But, they date back to 1920 with insulin. They're essentially amino acids that are chained together, and anywhere from 2 to 50-ish are considered peptides. They're smaller, but largely used in therapeutics. Thousands of peptides exist today. And they're just incredible in that they can not only be used to treat conditions that are currently existing, but we can utilize them to mitigate disease processes as well.
Okay. So how are peptides, I want to just kind of break it down even further. So you just mentioned that insulin is actually a peptide. Is that accurate?
Right. So, when you get above 50, you start looking at proteins. So lower than 50, you're looking at, how's the best way to describe it? When you're in the peptide category, you're getting a much slower response, right, for what you're trying to achieve. So I'll use, for instance, a secretagogue, something like CJC 1295, tesamorelin, or sermorelin, which are going into the body via an injection and telling the pituitary, let's stimulate the pituitary to create a little bit of growth hormone. So it's a very slow process. It's signaling, right? You don't get an instantaneous result overnight. It's a process. You have something like insulin where you start moving into a longer chain and you get a much faster response, right? You could kill somebody with insulin essentially because you get a much quicker response. So and I'm trying to kind of simplify this as much as I can. So if it becomes larger than 50, you're moving into the protein category. So, I don't want to broad stroke it and say that you're going to say that everything is, therapeutic, because not all peptides are going to create the same response, but when you start to get larger, you get a much faster response. So like I said, when you start moving into the protein category, when they're larger or longer than 15, that's going to create like that much faster response, if that makes sense. But they're not new in the sense that pretty much 140, I think I sent you the data. There's 140 therapeutics currently in clinical trial, and then there's 500 or so probably in preclinical trials. So the concept of them, while not or is newer in the aesthetic space being talked about, they're not newer in the sense that they've been around forever.
Right. So they've been here. It's just now all of a sudden everyone is catching on to it, and a lot of treaters are starting to use these in their practices. I had someone ask me a question recently, and they wanted to know, are Is peptide therapy the same thing as Ozempic, Wegovy, some of these weight loss drugs?
So they are peptides. GLP-1, so using the brand name Ozempic or semaglutide, is a GLP-1 receptor agonist. Then you get into a dual agonist, which is Mounjaro or tirzepatide. And that has both the GIP and the GLP-1 RA. So yes, essentially they are. And they're, in practice for me with semaglutide and tirzepatide, the long-term health benefits that I'm looking at for my patients with those particular peptides is pretty profound, to see inflammatory markers go down by more than half in patients. So I don't really think that the negativity that has been surrounding the use of those, and and I want to back up here because I'm kind of getting ahead of myself. First and foremost, GLP-1s are not new. Okay. I think that Byetta was the first one, and that was around 2007. In 2017, December of 2017, Ozempic received approval, FDA approval. And I think I started carrying the samples in the office in like January of 2018. So even then, while we didn't have a lot of the retrospective data that maybe we're getting now with regard to the protection against cardiovascular events and whatnot, and even the neurocognitive protection, we obviously didn't have that data. But the people that were getting so crazed about it on the internet was over, oh, you're taking these from, for diabetic patients. Listen, we got to be honest about type 2 diabetes. That is diet related issue. Do we know that insulin resistance develops as we age? Yes, absolutely. But the screaming that went on about people using it with regard to weight loss, that was a little much, because having optimum weight for a patient, being at your optimum weight, is a healthy thing. That's what we're about, health promotion. So I think it received a lot of negativity that was unnecessary. But yes, Ozempic or semaglutide, Mounjaro or tirzepatide, those are GLP-1s. They are peptides that we use in anti-aging medicine.
Okay. So there is this, category of peptides that are used for, or that can be used for weight loss or,
Right.
or weight management. What are some of the other categories of peptides? Because you said that there's like hundreds or thousands of different types of.
Well, it's again that therapeutic type of approach. So my big issues and the best way that I can put it when I'm looking at categories of peptides, if you will, is I take a patient, say for instance, 45 plus female, right? And I do an analysis on her after testing, and we see her muscle to fat ratio is very skewed. She has more body fat than she does muscle. So we already know that she's dealing with some sarcopenia. Obviously, we have concern, which is muscle wasting as we age. We worry about osteopenia, and then, of course, ultimately osteoporosis. So when I'm developing a plan, I'm looking at obviously the labs, and is she estrogen dominant? Has she lost estrogen? Is she progesterone? You're looking at hormones, and then you're looking at what is her insulin growth factor? What is her sex hormone binding globulin? You look at where is this patient in this particular snapshot of time. So with, say, for instance, a female in her 40s who's not putting on muscle, who's not exercising, I'm going to look at my array of peptides available for longevity purposes to try to then develop a program for her that's going to support lean muscle development. So what does that mean? That might mean some sermorelin or some tesamorelin, which is going to be, again, that secretagogue to help her to develop lean muscle and grow lean muscle, because that, of course, then leads to bone preservation. I will include a GLP-1 or a dual agonist in there, especially if her blood sugar is over 80, her fasting blood sugars are over 85 on testing. So I'm not necessarily, if she tells me she has brain fog, I might want to throw a neuropeptide in there. It just really depends on a case-by-case basis. My problem in this field is you'll see a bunch of patients being put on just, a set protocol regardless of what they're testing. So you're at this age, we should put you on this. A patient's peptide protocol should always be guided by what the testing showed you at the end of the day.
Yeah. Okay, that was kind of where I was about to go, because you're talking about, doing these different tests and kind of tailoring this to the
Right.
individual patient. And I know I've heard of people saying that they're getting peptides online somewhere from just some random website. And, so what if someone is going to try to find a reputable provider that is going to really, do the testing that needs to be done and really monitor, because I imagine you have to monitor this, right? You don't just put somebody in all these peptides and then say, all right, see you later. What should someone be looking for in a provider? What kind of uh, assessment should be done of the patient at the beginning? Can you just kind of walk me through like what the process looks like for somebody that's coming in and wants to get peptide treatment? How does the process start?
So in my practice, you are required to do some pretty extensive blood work. Um, I was able to, because it is very expensive to do blood work, especially if you're doing cash pay. So what we do is negotiate cash pricing with certain labs. So we initially do that testing, the blood work. And then from there, I prefer to use what's called a Dutch Plus, and I will use a ZRT for hormones. But what I like about my Dutch Plus testing is it gives me a 24-hour saliva and urine collection on my patient. So it tells me their comprehensive cortisol awakening response. It shows me all of the pathways for their metabolites. It gives me a great picture of their gut health, which is an endocrine marker that I look at. It tells me their glutathione. So it gives me a great snapshot over 24 hours as to how this patient is operating, if you will. Because that's the idea with peptides. You're looking to optimize that patient's function, right? Mm-hmm. Because does it mean you're not going to wake up and have a bad day? No, it doesn't mean you're not going to have aches and pains, but you're going to optimize that, the goal being that you're going to optimize that patient's cellular responses. So for instance, like we were talking about COVID and long COVID, you want to look at peptides that are going to support immune function, right? So that's that kind of arm of peptides. The brain fog that a lot of my patients, especially my perimenopausal and menopausal patients, complain of. So what are we going to do for some of that brain fog? We're going to look at some of those neuro type peptides. So you're tailoring it for what their concerns are and what their complaints are. So when a patient is trying to find a provider, well, you want a provider that has done training beyond the traditional allopathic, pathway that we learn in school, because it's a very different approach to patient care. Me in particular with the A4M and the fellowship in anti-aging and metabolic medicine that I'll be finished with in April, that for me is what I would tell patients and encourage them to go to that website, find a provider there. And then, of course, it has to be a provider that you align with. Mm-hmm. If you have a provider that isn't sitting and listening to you, then, I know myself wouldn't, as a consumer, what turned me off in primary care as a consumer of healthcare. So I know what I look for in a provider, too, in that respect.
Mm-hmm. So you mentioned that, they'll come in and do this initial blood work. Does that also include, do you test hormone levels and things like mm-hmm. that? Is that all part of it?
Yep.
Okay. And
absolutely. But the blood work that you do doesn't give you the same type of, the blood work is that fasting morning. How were they at 8 o'clock in the morning when they went in and did that blood work? Short of a hemoglobin A1C, which gives you a picture of how their blood sugars are running over 3 months. That doesn't give you a blood sample. That test isn't going to really give you that kind of reflective data. That's why I then move into that more advanced testing with that Dutch Plus, because it's a 24-hour snapshot, and it gives you a lot more comprehensive data. It tells you the metabolites of neurotransmitters, serotonin. You're able to look at a lot of different things. And again, when you have women that are still cycling, the blood work isn't going to capture, a lot of that variation. The 24-hour gives you a little bit more comprehensive information with that regard. But it's also too, you have to consider where they are in their cycle. Obviously, you have to consider what meds they're taking, because that's going to affect those metabolite pathways. But it's only as good as the what do I want to say here? That process, the testing process, is only as good as them following the rules. Because I've had patients, I had coffee in the morning, or or I ask patients that are doing the 24-hour collection, if you can, try not to take any sleep aids that night, try to keep your system as clean as possible leading up to that testing so that you have, relevant data.
Right. So once you have all of the data, then, you're going to analyze it and kind of determine then what peptides you think are going to be appropriate for that particular patient.
Right. So I do a write-up. I do a pretty comprehensive write-up. We review the labs, we go over things. And this is what I always say, I make suggestions and recommendations, and I want to empower the patient to make those decisions, because it's also about educating, about having patience, because it doesn't happen overnight. These are small molecules that are signaling in the body, excuse me, hey, pituitary, you're getting old, wake up, release a little growth hormone. And it's such small, low dosing that it really will take you 12, 16 weeks before you're like, you know what? I actually think I'm feeling it. I'm feeling different. My sleep is better. My skin looks a little better. So it's a process, an evolution. And that's why having communication ongoing with your provider is so important, because you tweak things as you go along.
Right. So, okay. So we come in, we do all of the testing, the blood work, go through the analysis with you. Then are these peptides coming from a compounding pharmacy? Like, is this a special kind of peptide cocktail that you're assembling for your patients?
Yeah, so I'm kind of glad you brought that up, because we have talked about that. Like when I sent you my copious notes about these pharmacies. So yeah, there's a lot of criteria. Yes, you are using a compounding pharmacy, and there really needs to be more providers need to be really responsible about where they're getting their stuff from, because that's really disconcerting to me. It's funny. What's that gal's name she's on HGTV? Oh my gosh, I'm drawing a blank. She has that show, Christina. I think it's like The Coast and Christina or something like that.
Yeah, she's got a new one now.
Yes. Yeah. So she had on her story a bunch of peptides, and she said something like, it's all about the NAD. And of course, me with peptides, I'm trying to zoom in on it and look. And she had a bottle from that Peptide Sciences that I sent in the notes I sent you. Mm-hmm. I was feverishly like, should I message her and tell her? No, those are research, use only. It's really jarring to me, the number of people that will order stuff online, peptides online. Number one, peptides are mass produced in China. Okay. So the only peptides that we should be putting in our body in this country are peptides that are sourced here in the US and that undergoes rigorous sterility testing, third party. I outside of the compounding pharmacy, that somebody's sterile testing those. The number of endotoxins that are removed in that sterility process, it's huge. So you start mass producing in China, and you get these companies that hop up and gain online, fame, like Peptide Sciences, even though it says research use only on the bottle, and these people are still injecting it. And I just sit back with my mouth open going, wow. And these will be the same people that will have issues with people that choose to get Botox. Like, it kind of goes hand in hand. And I'm thinking to myself, wait, the math isn't mathing. You're ordering peptides online for health and longevity, but then you're shaming people that choose to get Botox. And that's a decision too,
When in reality, these peptides are full of God knows what, because they're coming from China and they're not being tested or
just not undergoing any kind of sterility process, because that is a process in and of itself. When a compounding pharmacy that's reputable compounds, and I'll use, for instance, tesamorelin, right? Very commonly used. That has to go out, and it's about a 2-week process before that product is then ready to be shipped to a patient. So number one, that explains the expense associated with doing some of these peptides. And it explains the obviously the rigorous standards that these pharmacies, the compounding pharmacies, will use. I mean, a 503A pharmacy, which is those patient specific prescriptions, they have to go through a whole process to get to the standard to be able to send to patients. Yeah. So it's an expense. So when you're getting something for $150 online, and if you think it's worth it, well, I don't know what to tell a patient then,
Yeah.
because that's not my type of a patient that's willing to
Yeah.
jeopardize their health for that.
Wow. Can you explain for the listeners, because I think a lot of people probably don't understand the difference between a compounding pharmacy versus just a regular pharmacy?
Right. So a 503A, very simply, a 503A is going to be patient specific, right? And a 503A can farm out to a 503B, which is more of like your mass production, like outsourcing. They can, you know, contract, I don't know what the word is that I want to use for that, but they can then turn to a 503B to get a larger batch of something, but they're still then required to follow all of those standards, those USP standards with regard to making of the prescription for the patient. But 503 B are regulated by FDA, the 503B, and they can be inspected and whatnot. 503As, they follow that USP standard. They do that sterility testing. There's traceability. I think the biggest thing for me, and I've had this discussion with other providers, is if you encounter, like, say you want to work with a pharmacist or that owns a compounding pharmacy, if you can ask them, hey, show me your traceability, please. Where are you sourcing these raw ingredients from? And they're amenable and they open their books to you, that's somebody that you can feel comfortable working with. If you deal with a 503A and they don't want to have that discussion with you, and they have, you trying to get any kind of support for your patient or information or discuss dosing for a specific patient, if you deal with a lot of resistance for that, then I would say probably you need to run, because
Yeah.
that's not going to be somebody that has a lot of transparency for you.
Okay. So I have a lot of friends and acquaintances and people that I've talked to that are getting compounded semaglutide from some of these websites where you just go online, fill out a thing. I think some people have told me that they had to do some kind of initial blood work or something like that. So you're saying that those are probably coming from a compounding pharmacy where they're just getting these peptides from China and likely not doing any of this extra.
What I honestly don't know the answer to that. I
Yeah.
see it also everywhere online. I've had patients that maybe were seeking treatment elsewhere and then they had some adverse issues and they ended up coming to me, and I said, well, show me. They have to do our extensive blood work. And then they're like, well, I did some blood work with the other place. I said, well, you can send it to me. I'll look at it. And they did basically like a CBC with DIF, which looks at their blood. And then they did a BMP. They didn't even do a CMP, which is a comprehensive metabolic panel. And I'm looking at the lab work and I'm like, they didn't even order your pancreatic enzymes. So it's for me, I think there is, I think what's happened in this industry is a lot of money grab. And I think that it's far too simple for patients to get things in the world of the internet. And, everything from erectile dysfunction to weight loss to birth control now. I mean, my mind is exploding when I'm seeing all this stuff everywhere without any oversight or minimal oversight. And for me, and it isn't because, yes, I am probably a little bit control freakish when it comes time to my patient's health. But for me, it's just, I couldn't imagine doing that as a patient. I really couldn't as a consumer. So for me, I understand the ease of it and I get it. Your life is busy. So you click a button on the internet and you go and you do very minimal blood work, but is it really worth it in the aggregate? I have a pretty funny example. So I'm a huge lover of GHKCU, which is a copper peptide. It's probably one of the most incredible genome stabilizing peptides there is. And unfortunately, it was a part of the Category 2 change with the FDA. But in some of the instances, the compounding pharmacies that still had the raw ingredients, they were still making it. So I was still able to acquire it for very specific patients. But I had a gal that came to me and we were doing her intake, and she has a condition called Wilson's disease, which is like a copper storage disorder. And she was getting GHKCU from some online provider and from some compounding pharmacy. And I said, well, Wilson's disease is a copper. Your body can't process that. So why were they telling you it was okay to inject that? Well, it was just a part of this protocol for this. She was having elective surgery. And that was the part where I said, again, I just kind of cringe, because that online facilitating of things like that is just dangerous in the sense that, and we're not talking about, true telemedicine where you're establishing a patient-provider relationship. This is what I call like drive-by peptide shopping. Oh yeah, you're going to have some surgery. Well, this is going to be your protocol, and this is what you're going to do, and you'll do it for 45 days. I said, well, did your surgeon know that this is what you were doing? No. So it's not even a part of the surgeon that's taking care of her. So there's just a huge disconnect, I think, that's happening now because of the ease in which people are able to get things.
People don't know the risks of a lot of these things, and they just kind of hear about it and, oh, peptide therapy, it's this new great thing and it's going to make me look younger or feel better or whatever. And so they just kind of go out and they're Googling it, and then they find peptides.com and they're like, oh, great, I can just, order my peptides here. And so I think that, we need to kind of spread awareness about this and the reality that this is not just a one size fits all thing. This is something that you really do need to be working with a very knowledgeable provider to make sure that, you've done the proper testing and that you're getting the actual peptides that you need, that they're safe peptides, that they're being sourced from a reputable, safe place. So there's a lot here. It's not just this simple, oh, I'm going to go and get peptides.
No. And here's the kicker. In the notes that I sent you, where I referenced that pharmacy, the NECC in 2012, and that was what kind of propelled all those changes that were made in 2013. I mean, there were like 70 people that died and over 100 that were injured, and that was supposed to be a reputable pharmacist and a reputable compounding pharmacy. So people, I think that's the other part of it. It's just because it's a licensed compounding pharmacy, they went through all the initial red tape, they got their state license. You still need to do your due diligence because you're putting that in your body, and that's the other part too, where I have had pushback from some patients because I require labs every 6 months, and I appreciate that it's a pain to do that, but you want to make sure that what you are doing is actually benefiting them and not harming them, because that's the other part. I have had issues. I've had patients that have a mindset, I think, where if more is better, maybe instead of 2,500 micrograms, I'm going to do 3,000 or something like that. So close monitoring and making sure that you have a compliant patient. It's very much incumbent. Like, we as providers are responsible for respecting our patients' choices, but also making sure that we've educated them to ensure that they're compliant, because that's a huge part of the equation too. You have to make sure that you have a patient that is going to be a rule follower with those things. And when I've had other conversations with other providers, and I'm like, you have to make sure that you're doing these check-ins, because if you have a patient that's calling for refills too quickly, how long a bottle of say tesamorelin is supposed to last you. And if they're calling too soon, you need to have that conversation with your patient. How much are you doing? What are you doing? How are you dosing it? So it's just a huge part of that equation with not only responsible sourcing, but the responsibility of the provider to make sure that they're following up with the patient.
Yeah.
I know.
I feel like this is the case with everything that I talk about, because then people want to know, well, what do I do? How do I find the safe provider, the safe pharmacy? How can I even begin to do my due diligence and do my research? Because it's just, there's so much information and it's so hard to know. What are some red flags that you would say if someone's shopping around for, peptide therapy? Can you give us some red flags to kind of look out for?
Well, I can speak as if I were a patient, going to consume that. Not having a face-to-face with your provider, that to me is very disconcerting, because obviously the paperwork's extensive, but you want somebody that's going to go through that paperwork with you, talk to you about the things that they found. You want to get the information from your patient with regard to, talk to me about how you're feeling. You need to know what's going on as the provider, what's going on with the patient. So there's that issue. Another red flag is if you're speaking with your provider and they can't disclose to you who their compounding pharmacies are, As a patient, if you're receiving a prescription from a compounding pharmacy, you should be able to call that compounding pharmacy and have a conversation with the pharmacist if you have a question. But ultimately, you still need to circle back to your provider, because that's the other part of it too. I saw an interesting presentation by, I think her name is Dr. Mary Claire. She's like a menopause specialist, and
I follow her.
Yeah, she had prescribed for herself systemic estradiol as well as vaginal estradiol, and the pharmacy was refusing to fill it.
I saw that. I actually did see that the other day. Yeah.
So that's where I would tell, because you will have that. They'll push back at you. I was doing some altered dosing for a patient, and I had the pharmacy pushing back at me, and had to get on with the pharmacist and they ultimately did what I wanted them to do. So that was great. Mm-hmm. But so I think that part of it too, where you can't get someone live to talk to them about it, but ultimately you need to talk with your provider about your dosing and how you may want to tweak it. But so that's a red flag as a consumer. But as a provider that's trying to deal with peptides, I think the other red flag is, if you can't speak to the owner of the pharmacy and find out, again, can I please see your licensing? Can I please see your traceability records? Can I please, you want to deep dive in that respect before you align with any particular pharmacy. Mm-hmm. The biggest concern I have in Tampa is there are clinics that will draw up medication into syringes and dispense it to the patient without any kind of labeling, without them, knowing, is that 2 milligrams of semaglutide mixed with, L-carnitine, or is that 5? That to me is stressful. Mm-hmm. That distresses me as a provider, because I don't think that that's how things should be dispensed out of the office. Mm-hmm. That's just me, Yeah. I want my patients to have their bottle from the pharmacy, their syringes. We teach them how to draw it up and how to do self-injection. Is it a little time consuming? Yeah. But I feel that that's a much better way to go for the patient.
Yeah. So, and I should have asked this earlier, all of these peptides are administered, like they're injected?
No, some are intranasal, okay. Some are drops. So no, there's all forms of ways to deliver. Okay. Injectable in the subcutaneous tissue and that fat gives you a slower release of that peptide. With the intranasal, you're going to get, probably a little bit quicker of a response. Mm-hmm. So it's just going to depend on what you're trying to accomplish with regard to how you're going to choose that delivery for the patient.
Okay. Are there specific peptides that are helpful for like skin? A lot of people that listen to this podcast are interested in skincare and, anti-aging stuff. Is that something that peptides can help with?
Absolutely. I mean, topically using GHKCU is pretty amazing. I did a presentation at a conference in Orlando and put up a before and after of a gunshot wound victim. And she was treated topically with GHKCU, and the scar was darn near invisible. So wow. It's pretty incredible how that works with wound healing. But yeah,
is that put into like a cream, or
you can do it? You can do it in a cream. So that was the one that I was talking about, also being super genome stabilizing, as mm-hmm. It's such a powerhouse of an antioxidant in injectable form, but topically it's really incredible for the skin. So yeah, I can have it formulated in a cream. I can have it formulated in a gel, depending upon my patient's, skin type. Mm-hmm. But it's just one of those things. I'm like, if only we could bathe in it, because it's just really cosmetically elegant. And what I like about the compounding pharmacy is you don't have, it's not going to be loaded with preservatives, because you have a shelf life. Mm-hmm. It's an elegant formulation, very quickly absorbed. It's safe for people because you're not going to have that systemic absorption of it. But you can put other peptides in it too, like mm-hmm. the matrixyl, like the lufazil, some of those neuromodulator type peptides for my patients that don't want Botox or a neuromodulator. So it's kind of nice because you can kind of get that wrinkle softening, mm-hmm. and then you have the elegance of the GHKCU, which supports collagen. So for skin, 100%. And you will see benefit to the skin even with some of the secretagogues like tesamorelin or sermorelin, some of those things that kids that are young don't appreciate, that we don't have as we age. We notice that improvement in our skin. I mean, yeah. I think for almost being 54, I'm like, my skin's not that bad, you know?
It looks great from here.
Oh, I'm talking about like my knees and my elbows, all those places that we get that crepiness. I'm like, it's not bad, you know?
I'm doing okay.
Yeah.
Well, speaking of, people who do not want to get Botox, I know we've kind of been having conversations about this recently because I've been sort of leaning towards I don't know if I want to get Botox anymore camp. And so I wanted to talk to you today. I am overdue for my tox appointment, and that's why it's so great to see you today, because I haven't, normally it's, every 3 to 4 months kind of clockwork I'm in for my appointment. But what are some other things? I know we just talked about, there are some options for topical peptides. What are some other things that you would suggest for patients who are kind of in the no tox camp? What are some things that we should be doing or could be doing to try to combat fine lines and wrinkles without getting the Botox or the Dysport?
So in patients that I have that make a decision, hey, I don't want to do this anymore. Number one, as a provider, obviously I respect their choices and we have conversations about it. And we talk about the science versus, their concerns with what they see and people posting and whatnot. I am a huge, huge believer in skin first, always. So skin health. And that starts from within. So once we know that patient is healthy and we start looking at what they can do that are non-tox interventions, obviously the topical that we talked about, I mentioned to you that new product that was launched by SkinCeuticals called Pediox, and their clinical studies were pretty interesting and pretty impressive because they were all in vivo. So it was all patients that were involved in the study. So you have your topical options. So like I said, the Lufazil, they don't disclose which peptides are in it. It's a dipeptide and a hexapeptide. So I'm deducing the dipeptide is the Sinake, and then the hexapeptide is the Matrixyl, or maybe it's argireline, I think. But so there's those topical formulations that are very elegant. And again, those can be compounded, or you will find them in a lot of over-the-counter products, but you'll have a lot of other ingredients in those too. And then you move into those treatments like microneedling. I mean, my gosh, that's been so extensively studied over the past 20 years. We know what collagen induction therapy does. We know that if you do a series of 4 spread out over once a month, you get a 400% return on your collagen. So there's that. You get a nice resurfacing, your tissue gets a little bit thicker. So it's nice. And especially because, you hit 30 and you're not making collagen anymore. So it's things like that. Then you have, of course, your chemical peels, that can be done every 30 days following the life of the cell. And it doesn't have to be the type of peel where, you're shedding for days. So there's other options that are going to yield a beautiful, nice canvas, which is your skin. It's not going to target the muscle, so it's not going to give you that same effect that actual treatment with tox would. But I think at the end of the day, as long as you have the conversations with your patients and you tell them the pros and the cons, all, of course, a part of informed consent, and then they're able to make a decision as to what they want to do. But the most important thing for me as a provider is I'm going to support what my patients want to do, and embrace their journey, because that's exactly what it is. It's their journey. I'm never going to shame a patient for making a choice to not do something.
Yeah. And I think that's important, because you don't want to go to a provider that is going to make you feel bad for doing something or not wanting to do something. And I certainly appreciate, because I think I had posted something about not wanting to do Botox anymore, and you DM'd me and said, "Oh no, like, am I ever going to see you again?" or something like that. And I was like, "Yes, I want to maybe come up with a different treatment plan." And you were like, "Absolutely," So yeah, that's definitely important. You never want to go to a provider for anything and feel like you're being gaslit or you're not being listened to, or they're going to try to talk you out of something, or whatever it is. I mean, you can have a conversation obviously about, like you said, the science and the information that we have, but at the end of the day, finding a provider that is going to listen to you and support your decisions. This isn't medical, right? Like, we're talking about wrinkles on the face, so it's not something where it's a life or death situation.
Correct. It's elective. Exactly.
Yeah.
Exactly.
Yeah.
I think that there's just, while I always respect the empowerment of patients and their choices that they make, I definitely hate to hear that, that tox gets a bad name. I mean, I was doing my deep dive of studies to prepare for this chat with you, and Botox is being looked at even in treatment of cancer because it slows that division. So there are some really great uses for it that that I think we'll see expanded in the years to come. But again, it's just about our role, because, and that's the other thing too, hubris. The hubris of medical providers is jarring. I see so many people, on the internet that the pontification of how great they are and how much they know. I'm an expert, and only I should be injecting. Only derms should be injecting. Mid-levels have no business injecting. It becomes this this hierarchy, if you will. And I think that like I always tell people, I don't know everything. I'm always learning. Hence the reason here I am 20 something years after my initial education. I'm always a student. I'm always learning. Never the smartest person in a room. But it's really at the end of the day, feeling heard by your provider. And as somebody that's had horrible experiences with providers that didn't listen, didn't care, and realizing, wow, it can be so intimidating when you're a consumer of healthcare services. It disappoints me, the massive amount of egos in this industry. And you and I were talking about that off camera. It's just disappointing to me because, while we go to providers for their expertise, nobody knows it all. And just because maybe something is used on label or off label or whatnot, there are providers that think outside of the box, and we do have to do that. And I do that with my patients, but you just have to have really good communication with your patient, and they have to feel heard. And that, I think, is the most important part of it,
Yeah, no, I totally agree with that. Okay, I want to ask you about one more thing, and then we'll wrap up because we've been going about an hour.
Yes. Okay.
Tell me about this salmon sperm facial that I keep seeing everywhere, and I saw an email that you sent out a couple weeks ago or months ago about it. So I want to get a little info. What is the deal with this?
So polynucleotides, pretty amazing. Not newer to the U.S. I was first exposed to them in Europe, and I believe it was before COVID, so the 2019-ish timeframe. And looking at some of the results was kind of mind-boggling. But they're, kind of what's the word I'm looking for? Harvesting, if you will, and I hate that term, from that salmon, the sperm, the DNA, and the regenerative properties. Again, collagen stimulation. Really skin improvement, skin laxity improvement, best done in a series. I feel like it's going to take off here. I don't know. I really don't know, because again, it's the big pharma pull and the FDA and, the South Korean company that's trying to get this foothold here in the US. I just don't know that they have the money behind being able to get the FDA to really sign off on them, if you will. But, and there's a lot of controversy too, because the company that I'm using presented me with paperwork that they had FDA approval, and I'm kind of questioning the integrity of it at this point of their paperwork. So I'm kind of holding off on pushing it too much, other than topically. So
that was actually a question that I had, because I think I've seen some videos of people where they were getting it injected, and then I've seen other people saying almost that they're getting it like microneedled into their skin.
Correct. So there is that you can use it as a cosmeceutical and microneedle it in, because that's not considered, even if it's like a mesotherapy, it's not considered injecting. But injecting is where we're looking at. So that's the other part too. You can have products. We have tons of products that have FDA approval. Say, for instance, Restylane Lift, which is a filler out of Galderma, and it didn't have approval for the hands, right? But we knew how incredible it was in the hands. We were using it for years off-label in the hands, and then they finally got approval in the hands. So we routinely in clinic do things that are considered off-label, right? But you still have an FDA approval for it as an injectable. And so that was where the issue with the polynucleotides came in for me, was I was presented with a paper that showed that it had this approval. But when I had Keith, my husband, doing the deep dive on it, we really weren't finding what made me comfortable with that. Mm-hmm. So, for now, I'll just have to continue to play with them injectably over when I'm over in Europe, because that's the sad part. It's a great option for patients, and a very natural option because it's not a filler, mm-hmm. and it yields really beautiful results. But, again, there's a huge money relationship between Big Pharma and our FDA, mm-hmm. which is disappointing, because the people, just like when they moved some of those peptides that we were routinely using, then moving them to the category 2, I absolutely 1000% believe that Big Pharma was behind that push to move those.
Yeah. I mean, I know we've talked about the FDA before, and there's a lot of stuff going on behind the scenes. So, all right.
It becomes hard, because you essentially are handcuffing providers from doing safe things with their patients, and you're trying to control how a provider treats their patient, mm-hmm. and that to me is never okay. Yeah. Especially when we know that something has a huge safety profile in Europe.
Yeah.
And especially in the UK. I mean, UK is one of the most controlling countries with regard to healthcare for their patients, mm-hmm. with their citizens. Yeah. And they've been used there forever, and they just yield really beautiful natural results.
Huh. All right. So for now,
we stick with PRF.
Okay.
and Easy Gel. There's options.
Easy Gel. Yeah. Easy Gel is another thing that I've been kind of wanting to talk to you about, because I've been seeing a lot on the Easy Gel, and looking at a lot of the research on that product. And, because I think there's also a shift from people that are, not wanting to do the kind of traditional fillers anymore, and the hyaluronic acid fillers. So can you just quickly tell us a little bit about the Easy Gel? Because I think that people would be.
Well, the thing that's amazing is it's autologous. I draw your blood, and I spin it at certain spin speeds and time. And then from there, through heating and cooling, I literally make like a gel, mm-hmm. that, it's not one and done treatment. You traditionally are like maybe 2 to 3, but it's biostimulatory because it's your own product, and it's your own growth factors. And it has that same benefit that PRF offers, which is, you have a much slower release of those growth factors. It takes over about a week, and then that slower decline. So you're getting that biostimulatory effect. You're getting that mild volume revolumization where it's needed. Mm-hmm. And you're getting a really a beautiful glow to the skin.
It's just made from your own blood.
Yep. No additives, no nothing.
To it.
Nope, nothing. All you. And it's pretty amazing. I mean, that's for those patients. That's for my patients. Like, I was always hesitant. I would never use a biostim in somebody that had an active autoimmune disorder. Mm-hmm. And I loved that we had an option. We have an option now with something like biofiller, and being able to give them some volume where they need it. Mm-hmm. And it's natural, and their body's not going to have any interaction with it.
Yeah. And you said you need like 2 or 3 of the treatments, but then how often?
Traditionally. So initially, depending upon the significance of volume loss or what you're trying to treat, you say about 2 to 3. Like, when I have patients that are doing PRF, say for the under eyes, not the Easy Gel, if they just want to do the PRF, that's about a 2 to 3, maybe 3 to 4 treatment, depending upon the severity of the hollowness or the darkness of the tissue. But with Easy Gel, because you get quite a bit of product, you're looking at 2 to 3, maybe spread out over 4 to 6 weeks. And then you just kind of move into what I would call a maintenance, where you're as needed. Okay. It's always, you'll hear people, well, I think I need a top up. I think I need filler. It's the same principle. Just because it's been a year doesn't mean you need something. Yeah. You need to assess, look at what changes, age-related changes that have happened to the tissue and the bone and the skin, and address it from there, and develop a plan.
Okay. All right. So I think I need to make an appointment for some microneedling and some Easy Gel.
Yeah. And if nothing else, just so I can fill you in on all this stuff we're not talking about on here.
All right. Well, I can't wait. I will be in soon to see you. Thank you so much for being on here today. This was very informative, and I hope that it can, just give people a little more guidance if they're interested in peptides and what they should be looking for. And then if anybody is interested in either coming in to see you or learning more information about you, where can they find you?
Through our website, you can, there's call to action buttons in there. And yeah, if anybody has questions about anything that they've heard or want to ask me, maybe farm, whatever, I'm happy, they can send a DM. And I mean, I have a social media girl, but I do try to get in there sometimes to see messages. So I'm happy to try to help people as best I can so that they're safe,
Yeah.
at the end of the day.
Yeah. All right. Well, thank you so
Thank
much.
you.
I will see
So
you
good to
soon.
see you. All right. Take
Bye.
care. Bye.